So there are a range of products that are chemically quite similar to our existing array of illicit drugs. Some of them are stimulants. Many of them are like cocaine or LSD or magic mushrooms or ecstasy. Some of them are like cannabis, or like very strong types of cannabis and skunk. And so some of them are stimulants and some are depressants. So they're just another set of drugs that act on the brain. They're sort of psychoactive substances. And they're being consumed now by Irish people who probably didn't consume psychoactive substances apart from alcohol in the past. Well, the main effect is on the brain, because that's why anybody who takes a psychoactive substance takes it, because it changes the mood. It makes you feel higher or lower, usually higher, so most people will take them to have a high. They tend to be cheaper than illegal drugs, so that's another attraction. And they're easily available, and they're not against the law at the moment, so therefore people can go in and buy whatever they like. So the short-term effects are on mental health state. I mean, some people can become acutely psychotic. Some people can get delusions and hallucinations and have a bad trip, as one would say. And then the other big effect in terms of systems of the body is on the heart. Some of them are what we call cardiotoxic. In others, they affect the heart, and they can mimic a heart attack if you get constriction of the arteries in the heart. If you get constriction of arteries in the limbs, you can get gangrene. I think if a lot of them are taken, you can have problems with the kidneys or with the liver, but mainly the brain. That's why people take them. But the effects are not just confined to the brain. And of course, we don't know for some exactly which drug is it, because if somebody takes more than one drug, it can be hard to prove exactly which one is causing the problem. We don't know exactly the long-term effects, but on the basis that they're going to mimic things like cannabis and ecstasy, we can expect long-term effects on memory and on cognition or cognitive function, or your brain capacity, and also on mental health state in terms of psychosis. We know a lot of people are admitted to mental hospitals because of problems with cannabis, so we can expect more of the same, and even more so because the type of cannabis derivatives that are sold in head shops are stronger. There have been documented cases of acute heart problems, cardiac problems, pericarditis and myocarditis, which is inflammation of the lining of the heart and of the heart muscle itself, have been associated or believed to be associated with one of these products. We haven't had any documented or proven death in Ireland yet. There certainly have been quite a lot of deaths in the United Kingdom and in other European countries. If people take these substances and take other substances as well, as I said, people can be admitted with an acute psychotic breakdown, but it can be hard to say it's this product versus that, because the studies haven't been done yet. But and equally, of course, we've only two ways of knowing whether people have taken them. One is if they say, they admit or report that they have taken a particular product. The other way that clinical staff will know is if they take urine testing, and that's only developing. They are a problem, and certainly potentially a large problem, because there are lots of these shops now. They have very high demand, lots of customers selling strong, cheap drugs. So it is inevitable that if something isn't done, that we will, as a population, see problems in all age groups, young and not so young. Well, on the basis that they're chemically very similar, one I expect that the injury profile will be similar. I mean, I think the difference with the legal highs is more people are taking them because there's no legal impediment to taking them. You stand outside a head shop, you'd be amazed at the number of people who are going in. People pull up in a car, hop in, come out with stuff for the night. So, like the chemical composition of these highs, legal highs or head shop highs, are pretty well the same as with our current array of illicit drugs. So we can expect that the impact will be the same type of impact, and whether it will be greater or not. My own feeling is if the head shops are allowed to expand, the volume of harm will be greater because more people will be taking them. People take them now who probably wouldn't take illicit drugs that easily.